the best. You know, it's for people, like it's for Kingman, actually. It's make it convenient for the Kingman. It's for the whole region, yeah. Okay. Thank you. You bet.
Here. I'm here.
Did you get tested?
I don't think your mic's on. It looks like they're ahead of us on the video for some reason. Yeah.
Okay, I'd like to call this special meeting together. It's October the 1st. Madam Clerk, would you do a roll call, please?
Supervisor Johnson, are you there?
What, are we going to do, what, 2 out of 3? Yeah, I'm here.
Supervisor Gould?
Here.
Okay, and we have Supervisor Watson, Supervisor Angus, and Chairman Bishop present.
Okay, thank you very much. First agenda item is a discussion of possible action, an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19, updates, and taking any necessary actions based upon the updates. We have Denise Burley at the podium. She's our Public Health Director, and I'll turn the floor over to you.
Madam Chair, members of the board, I will start off with our usual numbers. We've had 3,894 cases to date in Mojave County, 215 deaths, 3,519 recovered. So we're definitely making progress in that area. That's very nice to see. Our average age of cases is 47.7 years of age. Average age of death is 75.9 years of age. So not a lot of change. Again, those have been sort of incremental and very small over the course of the last 4 months or so. I do want to remind people about the public and the board about the testing event in Lake Havasu City. Tomorrow there are 280 participant spots available. This is at the Lake Havasu City Community Center at 100 Park Avenue, from 8 o'clock to 1 o'clock, and there is a pre-registration required, and we did put some information out via a press release, I believe, through our communications director and also on our webpage.
I have a question on this one, Madam Chair.
Yes, go ahead.
Thank you, Madam Chair. Since we do not count most antigen tests in our confirmed case count, do we count saliva tests?
They would be considered probable cases, Supervisor Johnson, so the answer would be no.
Mm-hmm. All right, thank you.
Mm-hmm. Yes, absolutely. Okay.
Madam Chair?
Supervisor Angus.
Are you done? Are you going to mention about the free COVID testing in Bullhead?
I don't know that I have.
People don't really know about this.
I don't have any information.
I only know about it because a friend of mine had to get a test for a procedure, and he made his appointment. Then they said, you can just go over to the college, MCC. It's a zero-cost COVID testing located at MCC. Make an appointment online. Walk-ins are welcome. Hours of operation are 6 a.m. to 2 p.m., Monday through Sunday. And this is the Embry Women's Health.
Yes, yes. So we have promoted that, and that actually is available at all 3 of the MCC college campuses in this area. So Lake Havasu City, Bullhead City, and Kingman campuses all have that testing available.
Okay, if we can promote that more, because when he went over there, they were like, no one's coming. It doesn't, and everyone I talk to, nobody knows. So I'm trying to promote it, and it's free testing, and apparently it was a good experience for my friend who had it done.
Great.
Actually,
and we'll try to do more with that.
That's been promoted for, what, 3 weeks now? And in fact, I went there and got tested.
Down at MCC in Bullhead?
In Kingman.
Oh, in Kingman. Okay.
So it's going on at all the MCC campuses.
Maybe that was the confusion. They thought it was just Kingman.
Yeah.
Okay, thank you.
Mm-hmm, certainly. I just wanted to make sure I cover the hospital update and ask if there were any particular questions related to the hospital update that was provided this morning.
Any questions for Denise?
Okay.
See none.
All right. Move on to the benchmarks. The benchmarks were updated this morning at 9 o'clock a.m. And I specifically always point out the business benchmarks, and it shows that we are in the minimal category for percent positivity and COVID-like illness hospitalizations. And we are right on the cusp of minimal for cases per 100,000. So we're just kind of riding that line between moderate and minimal. So hopefully we can get there into the minimal for 2 weeks and stay there. So it's a great place to be, and we appreciate the public's help and assistance in getting us there. Any questions about the benchmarks? Okay. I wanted to run through an update on enforcement activities and where we're at, and I do have Ron Balsamo here, whose team is more responsible for the activities around enforcement. And I will have him come up and speak to a chart that he has developed, a graph that'll give you some insight into the number of investigations, the number of re-inspections, moving into stage 3, and where some of those, where those complaints are coming from, and the percentage. So, Ron, if you wouldn't mind.
Good afternoon, Ron. Thank you.
Good afternoon, Madam Chair, and good afternoon, Board. So, since we began doing a comprehensive response to the public calling in and complaining about businesses not following the executive orders, we've had a total of 81 inspections and re-inspections of businesses. Of the 4 major categories, the bars and with and without dine-in, the gyms and fitness centers, the indoor theaters, and the water parks, all of our complaints have been either in the bars or the gyms. And so for the month of September, we inspected 11 gyms and fitness centers and conducted a total of 25 inspections. The bars, plus or minus dining, we investigated 44 companies and conducted 37 re-inspections of them. So our total now is roughly 106 total inspections that we've conducted. And about 60%, a little bit more than that, of the gyms and fitness centers were in compliance on the first inspection. And for the bars and plus or minus dining, it was about 43%. We did have to go to a number of establishments for the second inspections, which, if you recall, the first one was education and documentation of the violations of the executive order. The second one was, essentially, here's some more literature. You really need to get into compliance, and we are now documenting this. The third triggers an automatic letter to the company, as well as 2 following random inspections to ensure that they have come into compliance. And so we had 2 of those in the gyms. We had 2 of those with the bars. And finally, with regards to where are these complaints coming from, we've received 3 spreadsheets from the state over the last month. About half of those were overlap for complaints that we already received locally. So had 39 call-ins from either local phone or website, including Facebook. And then we've had 16 unique ones from the state. So 70% of what we're receiving complaint-wise is coming in locally, and then about 30% is being sent to the state and then coming back to us. So I'd be happy to answer any questions with regards to the data or our procedures at this point.
Okay, does anyone have any questions for Mr. Balsamo? Supervisor
I have a question, Madam Chair.
Supervisor Johnson, go ahead.
Okay. I guess this would be for you, Ron. I've had some inquiries from, I guess it would be the bars, where some people are arguing over what constitutes a mask, and they seem to think they can pull their T-shirt up over their face. And obviously, everybody wants to comply with the governor's orders so that we can get businesses open and keep the numbers down. Are T-shirts allowed to be pulled over your face for a face covering?
Supervisor Johnson, I would have to say no on that one. No, the inspectors are being pretty liberal about what we are allowing, for masks. We're not doing, trying to decide whether or not the face mask has a certain quality or whether or not it's recommended by any government agency. Simply, if we're walking in and they're wearing masks, then we're calling them in compliance. However, that said, someone pulling a T-shirt over their head or, using another type of clothing to cover themselves when an inspector comes in, I don't think qualifies. So, and I haven't really run into that yet. So, at least the inspectors, during their visits haven't encountered that and reported it back.
So I guess we would say that it's just, you're not saying they're approved masks, but mask-like apparatuses would be what people are supposed to use. It's just to protect our bars so that they don't get in trouble.
Yes. And, again, there's been some studies now, and I'm sure you can find it out on the web. Some of the studies are more scientific than others. But there is a huge difference between an N95 and, a silk sock or something like that. And what we're really trying to do is, just encourage the wearing of something so that the aerosolation of a potential virus is minimized. If everyone's wearing a mask, and then pretty much, what you're breathing, what you're speaking, all of the particles that are coming out of your mouth are being held, by you. And so the chance of spreading it is much less than, if no one's wearing a mask. And so, face shields, the gaiters, don't really do that great a job of protecting you, but they still protect other people. Whereas an N95 protects you and the other people. So, there really hasn't been that much guidance on what type of mask we would, we have the mask mandate for the bars and for the gyms and the indoor theaters and the water parks. But there's not a lot of specificity about what that constitutes. And so, at this point, I'm happy if an inspector walks in and the employees and the customers are wearing masks, regardless of what kind of mask they're wearing. All right, they're doing what they're supposed to do. They're trying their best to limit the spread. So that's where I am on it.
Okay, Supervisor Angus.
Thank you. I've received a few calls from some business owners, restaurant owners in my district, and that have had anonymous complaints, and that's where we're at. First question is, since the state has butted in and and are allowing these anonymous complaints to come through them, what's the percentage of rise from what kinds of complaints we were getting locally? Has it been a big rise, the number of complaints?
Not really. The complaints coming in from the state, as I said, have been pretty episodic. They're not, we don't get them on any sort of a regular basis. They just kind of come in when they come in.
Okay.
And a lot of them are overlaps. And so if the date period from the complaint coming from the state overlaps the complaint that we receive locally, we call that one. because it seems foolish to me to use our resources to go twice to a establishment, especially if we receive a local complaint, we go out, we look at it, they're fine, they're in compliance. 2 days later, we get a complaint from the state overlapping that same time period. We really need to go back out there again.
Well, that brings another question. So if you had a complaint and you went and everything was fine, and then the next day you get another one, do you have to go out by statute and go out or by executive order, go out and redo it?
As far as I understand, we do not, but we have been. If it's a new complaint, and it doesn't overlap a previous complaint, we go back out again.
But a new complaint about the same thing?
About the same thing.
Okay. So the issue in my district was buffets. There seemed to have been a little confusion about, buffets. And as I understand it, so this particular business had been told that they couldn't have a buffet at all. And but how I understand it, and I want it out there, is that if there are servers, just as long as the patrons are not touching the utensils or the food, if they're being served from the buffet by staff and they are social distancing, 6, just like what we do when we go to the deli or wherever in the store, we stand 6 feet apart, then that's okay. So am I correct in that?
Yes. Yes, absolutely. What we're recommending is that in instances where a buffet is part of the restaurant, that they either flip it around or they put plexiglass down so that the customers do not have access to the food, and then they have servers behind the counter who either then brings the food to the tables, or if they do have customers come up, that they make sure that they have the markings and they maintain social distancing, and that they wear masks while they're waiting for the food, and the whole 9 yards.
Right.
So.
I had asked Denise to read me the instructions on restaurants this morning, and do you have that with you? It's real quick.
Are you referring to the guidance from ADHS?
Yes.
Yes. Mm-hmm. Okay. Yes. And are you referring to the eliminate instances?
Like you go in with the mask, sit down with that one.
Got it. So, sorry, I don't know if we're referring to our inspection form or...
No. Just what the state wants you to do, what they are instructing restaurants how to conduct their business.
Sure. So there's certainly, of course, the enforcing physical distancing of 6 feet or more in most instances where people might congregate. Limiting parties to no more than 10, clearly marking tables or chairs or removing them to keep spacing there, prohibit open seating, enforcing the use of masks for both employees and customers, even if not mandated by local or county government.
But I'm talking about, you said you read me something this morning that said people are to come in,
right,
sit down,
right,
only get up to go to the bathroom.
That's under the prohibit open seating. So the next, underneath that bullet, it's customers should be brought to a designated seating area, of course, by a staff member, and patrons should stay seated throughout the duration of their visit, except to visit the bathroom, and may not be standing, mingling, or dancing. And
to which I said, if they said you had to raise your hand to go to the bathroom, that would have been my first grade instructions. That's how small it's become. And, the restaurant owners aren't expected to tell people to sit down if they get up. Those are just the instructions from the state, because I've gotten inquiries about that too.
Mm-hmm. Certainly. Yeah, and this is a should. So in this case, when we talk about enforceability of things that say should, it's guidance in some ways. Right. So really what we become more focused on is the social physical distancing piece and making sure that we maintain that, because in the absence of that, people can move around wherever they want. But if we create those physical distancing structures, then we've achieved that goal.
Okay. Because I do see people more out and about in restaurants now and enjoying themselves. And okay, I think that's all I have.
So in reference, if I might chime in just one moment on the masks to Supervisor Johnson's question, we do try to direct traffic to the CDC website for mask wearing, and they do have an actual link and a site that says how to select a mask, and it shows the effectiveness of the masks and what works and what doesn't work. And that's where Ron brought up the fact of gaiters and face shields. There's some caution around using those because face masks generally just come straight down and don't cover the bottom piece of it. So there's a gap here. And gaiters tend to be very thin, and so that leads to whether or not a T-shirt can be more effective. It depends on the weight of the T-shirt. Some are very thick, while others are very thin. But we generally just try to direct people to the CDC website about what's effective and what works, and ask that people do their best to meet those standards.
Okay. Any other questions?
Madam Chairman.
Supervisor Gould.
Denise, some of those masks are made by the Hanes Company?
Yes.
Which makes T-shirts and underwear?
Correct.
And they appear to me to be made out of T-shirt material.
They are, and I believe, and I haven't looked at the structure in a long time, Supervisor Gould, I'm not sure of the weight of them, if they're double.
They're heavy.
So that may very well be the case, is you have 2 layers of material, and that's what you're looking for, versus a T-shirt, which is probably just one. But again, a weight of a T-shirt.
I also saw a study that said a bandana was more effective than some masks.
I'm sorry, Supervisor Gould, I haven't seen that study, but if you wouldn't mind forwarding that to me, I'd appreciate reading it.
Sure, but my main question is, have we had to refer anybody to the courts for a cease and desist order?
We have not, no.
Good. Thank you.
You're welcome.
Denise, I have a question. Now that Lake Havasu City has joined Bullhead City in lifting their mask requirement, what does that actually mean for our residents in those areas as far as the governor's executive order?
Certainly. So it means for those businesses that are affected by the executive order, the restaurants, dine-in restaurants, bars, indoor gyms, fitness centers, water parks, tubing, indoor theaters, for those particular locations and types of businesses, they still need to maintain the requirements of the executive order, which include, generally speaking, mask wearing within and social distancing. And then outside of that, basically it would be based on the business itself and whether or not they require a mask or any kind of face covering going into their facility, their business, and that would become their call.
So we still have the majority of people being required to wear masks and protecting themselves and others.
In certain businesses, yes.
Okay, and then do we have the ability to not respond to the complaints that come into not only the state but to the county health office as well?
At this point, we are following the direction of the board in the process that we developed and proposed to you a few weeks ago. And beyond that, we've received guidance from the county attorney that we can pursue the Title 36 clause and use of that Title 36 clause to move forward with the enforcement actions.
Okay, I just wanted to clarify that because we're getting a fair amount of criticism that the county is going out, shutting down businesses and making threats, and that I personally myself have gone out with crime scene taped and closed down businesses, and it's just getting ridiculous. So I just wanted to bring that out and in front of everyone that it's still the governor's executive orders that we're in compliance with.
That's correct.
Thank you very much. Mm-hmm. Any other questions?
Denise, thank you. Denise, but so it's still up to us. And I know we're not going to talk about this today. I think we're going to talk more in depth at our next meeting, but we still have that ability. You were telling me that we are one of the few counties, if the only county, that is seems to think Title 36 allows us to do that, because there are other counties that are saying that that does not apply.
There are other counties where their legal opinion of their legal staff have said that they don't feel that they can pursue Title 36 and use Title 36 for enforcement activities.
Right.
So each county was instructed per ADHS to go back to their legal counsel to get an opinion and a recommendation moving forward, and so that is what we did as well, and that's what we were asked to do. So.
And since all of this and the extra complaints that come in, how's it your staff doing with it? And are they being harassed when they go out?
You know, I'd need to have Ron speak to the harassment piece, because he has a lot more interaction with his staff, so he can certainly speak to that. Initially, the first week and a half or so after we received the initial round of complaints from the public and from ADHS, it was quite a bit of work and most of their time to make sure that we could meet the criteria that was laid out and the time frames that were laid out per the process, right, that was approved. So since then, things have settled down and the complaints are still coming in, but not at that rate. And so we have been able to manage, but I've asked that Ron monitor our workload to ensure that we're still able to get our regular duties completed. And so I hopefully will have more information for you soon to make sure that we're to report back to you on that.
Okay, and just one more question. I'm sure you don't, because anonymous is anonymous, so there's no way of knowing if it's like the same complaint from the same person, because, there's like a whole other thing going on where now businesses are thinking that their competitors are going after them, and it's just not good for a community. It's just not. And even if it's not true, people talking about it's still bad. So if there's any way of knowing that.
Right. When the complaints come in, generally there's no name attached to them. So, and we don't know necessarily if we do get, say, a web-based complaint that comes in, we don't know if that particular person is attached to a business or a competitor. So that's not something that we have the information for. So they do become, anonymous in that sense.
Thanks.
Mm-hmm, certainly.
Anyone else?
Madam Chair.
Go ahead.
Has the WIC department opened back up, or still only face-to-face appointments?
You said WIC, is that correct, Supervisor Johnson?
Yes.
They are still in a virtual setting, so they are doing phone calls and I believe some video meetings when possible. I do know that there is, that's primarily directed by the state and hence approval from the federal government to operate in that manner. So I would need to check with the division manager to see where we're at with that, as far as if they have some anticipated date when they'll revert back to an in-person visit. Would you like me to check on that?
Yes, please. That would be great.
Sure.
Do we have any other departments that you know of that are still not open for face-to-face?
Departments or services?
Either.
Okay. We are looking into the senior nutrition program and moving into.
I hear an echo.
I do. We are looking into moving, we have a plan and it's moving back. The plan is to start transitioning back to a in-person service. Still offering drive-through for those that are uncomfortable going into a congregate setting. But looking at what I asked of staff is to determine what are our benchmarks for moving into back into an in-person service, and are they based on state benchmarks? Are they based on our local data? And what happens if we shift into a moderate substantial range again? Do we then close it? And how does that impact the customers? So I've asked for some additional information before we move forward with the implementation of that plan.
Thank you.
Mm-hmm. Okay, anyone else?
Oh, so one add to that, Supervisor Johnson and members of the board, we are doing some immunizations for kids. I think you were probably already aware of that, and we are starting operations of immunizations for adults as well. So if there's anything to add, I'll make sure that I get back with you and keep you informed of that.
Okay. Any other questions or comments?
Madam Chair?
Yes, go ahead.
Just something I thought of. The agreement with the state, aren't they paying us for doing the inspections?
What they've done is given us $25,000 that the board approved several meetings ago. That funding is to be used for education and technical assistance primarily. It is COVID complaint driven, of course, so that's where they're channeling those complaints to us when they receive them. And yes, it does give us the authority to operate in the enforcement world. Although Title 36 does that as well. So.
Thank you.
Mm-hmm.
Okay, anyone else? All right, Denise, do you have anything in closing?
I do not, no.
Okay,
Thank
you
you
very much. We'll go on to the next item. This will be a discussion of possible action. Call for a special joint board meeting with the Kingman City Council immediately following the board's October 19th, 2020 meeting to receive a report on the Wallapai Basin groundwater model presentation by Jamie Macy, USGS. This is under County Manager Sam Elters. Supervisor Johnson, did you have something?
Yes, Madam Chair. If we're going to consider this, I would think we should probably do a time set instead of just saying after the meeting. That way we don't tie a lot of people up.
Could you repeat that? I couldn't understand it. I'm sorry.
I would suggest that if we're going to do that, we should do a time set so that we don't tie a lot of people up waiting for our meeting to end. The only people that would inconvenience would be us and not USGS and the City of Kingman.
Yes, I think County Manager Elters has some information on that scheduling.
Madam Chairman, board members, good afternoon. This item is related to a study that the board authorized of the Wallapai Basin groundwater by the USGS, and that's United States Geologic Surveys, about 3 years ago. It was about 2017 to monitor and study this aquifer. The study consists of just modeling the water table and providing a final report. The study is substantially complete, and the findings will be presented to both the Board of Supervisors and the City of Kingman, we hope, in a joint session. The presentation is going to be hybrid in a sense, meaning it will be by individuals present here, as well as telephonic participation, and it is intended to take place on October 19th during a regular board meeting. So the idea is the board will meet, board will take care of business, and at the very end, the board will adjourn, and then the board will reconvene with the city mayor and council member in the audience present, the presentation would take place. There would be an opportunity for elected officials as well as technical staff, audience to ask questions, and then that will conclude. So there will only be one item on the agenda. It will be the presentation, and the coordination. That meeting is being coordinated between our clerk of the board and the city clerk of the board as well. City clerk.
Okay.
Madam Chair, and I believe that's Supervisor Johnson's goal with a time set would be, because we don't know what time our meeting ends, so do we want to say like 1 o'clock? Do we want to say, so that it gives them the opportunity to show up at a specific time versus sitting through the end of our meeting and then continuing through is what he's asking.
I would recommend personally that it start at 1 o'clock after lunch. If our meeting goes right up to 1 o'clock, then we can just adjourn, like you said, county manager, and then begin the presentation afterwards. But if we set 1 o'clock, at least everybody can go enjoy a lunch that's not here with our county meeting.
Madam Chairman, board members, that sounds great. We do not have any specific time slot. What you're suggesting and what Supervisor Johnson is suggesting makes perfect sense. It gives the board enough time to conduct business, complete. Should the board meeting run long, it'll still be fine and will allow time for a light lunch or something along those lines. So yeah, that would be great.
I would say on that date, maybe a sack lunch might be a good idea.
By the way, though, since we're mentioning lunch, the county will not be providing lunch. Just for clarity, it's everybody on their own. Just wanted to point that out.
I'm a little disappointed. I was looking forward to having steak tips or something. Yeah. Madam Chairman, I'd like to make a motion for us to call for a special joint board meeting with the City of Kingman and our board to receive the report on the USGS Wallapai Basin groundwater model.
I'll second that.
Would that be at 1 o'clock?
At 1 o'clock, October 19th, 2020.
Okay, we have a motion from Supervisor Watson, seconded by Supervisor Angus. There's no further discussion. All those in favor say aye.
Aye.
Any opposed? Okay, motion does pass. Thank you very much. Going on to the next and final item. This will be a discussion of possible action. Request to address a request from the Arizona Fire District Association to conduct a regional statutory training session in the board auditorium either on January 22nd, preferred, or March 26, 2021. County Manager Elters, this is under your name.
Yes,
You
Madam.
had discussion?
Yes, Madam Chairman and board members. This item came before the board a couple of weeks ago. The fire chief, representing the Arizona Fire District Association, came by, asked to use the auditorium for their meeting so they can maintain the social distancing and the CDC guidelines. The board asked him to consider other options and to come back once he and the group has exhausted other options, to come back and request the board to use the auditorium if they're unsuccessful. So the Arizona Fire District Association still needs a facility, and they are asking for the use of the auditorium and are committed to comply with the requirements of the board for this facility.
Okay, thank you.
Madam Chairman, I'd like to make a motion for the approval of the Arizona Fire District Association to conduct the regional statutory training session here in the board auditorium on either date, January 22nd or March 26th, as they have complied with our original request for investigating other avenues. So,
Okay, we have a
that's my
motion
I just have a question. Do we need the actual date, or can we just put January 20th and then they decide, or do we need to put in the motion the actual date?
Supervisor Angus, we included both dates in the motion to give them a little bit of flexibility.
Okay.
I think they indicate that January 22nd is the preferred one, and we trust that this auditorium is available on that day, but if it isn't, then they can use the other date.
Got it. Then I'll second that motion.
Madam Chair, which is why we would
Discussion,
prefer
Madam
a
Chair.
date be picked so that we can ensure that the auditorium is available, because we do the reservations through our office, and if they don't specify a date, it may not be available when they need it. So pick a date.
So I'm confused now.
We prefer you to pick a date so we can ensure that it's available so that somebody else doesn't reserve, not knowing which date they're going to choose.
Okay, Supervisor Johnson.
Thank you, Madam Chair. Mr. Elters gave a long explanation there, but either I'm not seeing in my backup all the things that we ask him to do, any kind of documentation.
Madam Chair, Supervisor Johnson, I do not have documentations. I did not ask for it. I accepted a word of mouth.
Madam Chair, don't we
Supervisor
provide the documentation? Don't we tell them what we expect when they use our facility?
Supervisor Angus, I think yes to your answer to your question. I think Supervisor Johnson was asking me if I had any documentations to support the fact that they exhausted other options before they came back to us.
All right.
So I answered his question by saying that I accepted word of mouth and I do not have any documentation.
Okay.
To your question, though, Supervisor Angus, we will indeed, everything that is in place at the time as far as the requirement to use the auditorium will be asked of them, and they will ensure that they comply.
Okay, we have a motion on the floor and a second.
And before we go further with that, I would ask if Supervisor Watson would consider amending the motion to specify a date as the clerk recommended.
Okay. Authorize the use of the board auditorium for the Arizona Fire District Association to conduct a regional statutory training session either January 22nd, which is the preferred, or March 26, 2021, for that date to be registered with the clerk of the court by the Fire District Association. Will that work?
I think what she's asking is one of the two.
The 22nd.
They prefer January 20th.
All right. Make my motion for the Arizona Fire District Association to use our board auditorium on January 22nd.
Thank you. Yeah.
And I'll amend my second.
Okay, we have a motion on the floor, an amended motion, an amended second. There's no further discussion. All those in favor say aye.
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 Are there any opposed?
Aye.
Okay, motion passes. And the meeting is adjourned.
Supervisor Johnson.
Has left the conference.